As a Medicare beneficiary, it is important to know how the drug formulary for your Medicare Part D prescription drug plan works. The formulary is the list of drugs covered by your Part D plan. The drugs on most formularies are grouped into tiers based on cost. Generally, a drug in a lower tier will cost less than a drug in a higher tier. In addition to cost, it's important to know that there may be some drug restrictions on the formulary. For example, some drugs may require prior authorization. This means that you or your doctor will need to get approval from your health plan before you fill your prescription. If you don't get approval, your health plan may not cover the drug. Other drugs may have quantity limits, which means your health plan may limit the amount of the drug it covers. For example, you may only be able to get a 30-day supply until your next refill. In some cases, you may be required to try certain drugs to treat your medical condition first before a different drug for that condition will be covered. This is known as step therapy. For example, if drug A and drug B both treat your medical condition, your health plan may not cover drug B unless you first try drug A. If drug A does not work for you, your health plan will then cover drug B. You or your doctor may request an exception to any of the limitations on the formulary. You may even ask your health plan to cover a drug that's not on the formulary. If your health plan makes any changes to the formulary or adds restrictions or limitations to drugs, they must notify anyone who is affected at least 60 days prior to the effective date of the change or at the time the beneficiary requests a refill of the drug. If your health plan removes a drug from the formulary altogether, any member currently taking the drug will be allowed to continue for the remainder of the plan year. Any new prescriptions for the drug, however, will not be covered. If you have questions, we are here to help. Call us and let one of our licensed agents help, or contact your local Social Security office for more information.